Welcome to our Centre for Economic Policy Research webinar on how COVID-19 affects women. My name's Tim Phillips and I'm going to be moderating for the next hour. Well, we've got 3 people and 2 papers on the panel today, and our topic is gender inequality in work and, relatedly, in COVID-19 mortality. Now, in a moment, we're going to be hearing from Michèle Tertilt of Mannheim University and Matthias Doepke from Northwestern, who will be talking about their paper, The Impact of COVID-19 on Gender Equality. Well, welcome, both of you.
Thanks for having us.
Yeah, you're very welcome. And also today, Renée Adams of the Saïd Business School, University of Oxford, who's going to be talking about her paper, Gender Equality in Work and COVID-19 Deaths. Renée, welcome as well.
Thank you.
Now, before we start, actually, though, for the panel, I'd like to ask all 3 of you about this. The pandemic, it's created a situation which has exposed the differential treatment of women and the different outcomes for women. And we're starting to see papers like yours that focus on that. Does this encourage you that the subject is at least getting the attention that it deserves? Renée, could you start with that?
Well, I think the topic never gets the attention it deserves. And it's been a little bit on the radar, but I think we need to do much more work on this. It starts from not having gender disaggregated data to really investigating, what's going on. So yeah, no, I don't think there's enough attention.
Matthias, what about you?
I certainly do think that the crisis puts issues of childcare and families into the spotlight because we now all have to deal, if we have children, with a lot higher childcare responsibilities than usual. So it does put more of a spotlight than usual. But I think I do agree with Renée, maybe still not quite enough because it's really very central to what's going on right now. And I still feel sometimes there's a bit of a perception that it's a bit of a secondary issue compared to broader macroeconomic question, even though this really ties very much into what is happening, not just at the micro level, but also to the economy as a whole.
Yeah, Michèle, do you agree with the other 2 members?
I largely agree. I guess what I would like to add is that even though among economists, among researchers, we've actually seen quite a bit of research, I think it's really still under the radar among the politicians. I think we need a little bit more, in the media. We talk a lot more about hotels opening and the airline industry than about families, even though this is very central.
Yes, it is very interesting. It has, at the early stages of the crisis, it did seem to have this very sort of male business attitude to them and much less of an emphasis on households. Well, in our small way today, we're changing that emphasis a little bit, I hope. Now, Matthias and Michèle, I'd like to start with your paper today, looking at the short run effect on work and in the home. Now, you wrote in your paper that effects of the current crisis on women versus men are likely to be sharply distinct from those of other economic downturns. Now, we're going to be talking about this for the next 10 minutes or so. But briefly, Matthias, what is different this time?
So what is different is that we have a recession that hits women actually harder than men. And the interesting thing there is that the usual pattern is exactly the opposite. So in a regular recession, we see that men lose many more jobs than women do, to a large extent because of different distribution of employment across sectors. So I'm showing here a picture of unemployment in the United States. And you see in the 2008-2009 recession, which is shaded in gray, that the red line, which is unemployment for men, goes up much more than that for women. This has to do because many men work in sectors like construction that go down very fast. It also has to do with what happens inside families. So we see that in some families where men lose jobs, women decide to maybe work more or join the labor force to buffer some of this loss of income for the family. This is the usual pattern. Right now, we see something completely different. We see that women losing many more jobs than men do. So you can barely see it at the end over here. But in the most recent unemployment report, we see women's unemployment about 3 percentage points higher than men's unemployment, which is really completely unprecedented for an economic downturn, for as long as we have data.
Yes, because you previously had an article out, I think it was about 4 years ago, where you analysed the fluctuation in men's employment over an economic cycle compared to that for women. Is the traditional pattern that basically women's employment doesn't change very much over the economic cycle and men's goes up and down much more?
Yes, that's right. So usually men's employment is very cyclical. Women's employment, to some extent, because they work more in sectors like healthcare and education that are less cyclical, depends less on the business cycle. But again, this insurance mechanism is also very important, that you have a bit of a compensation that some married women in particular enter the labor force in a downturn to make up for an income loss for the family. And this is one reason why this different pattern now really matters for the macroeconomic response, because this shock absorber of families reacting together to the shock is really absent, because it hits both genders and women actually even a little bit harder.
Now, Michèle, I noticed that this time you've analyzed jobs, not just by the numbers of jobs, but the types of jobs that they are. And you looked at jobs that are critical and telecommutable. Why did you do this for this crisis, and how does this vary from the macro indicator?
Yeah, so we thought that two things are very critical in this current recession. First, certain sectors are simply closed. So think about retail. A lot of retail was closed, restaurants, tourism. And so the question is, what are the jobs that are most protected? And so there we think two factors are critical. One, whether a job can be done from home. So whether a job is, is possible to telecommute. And so we looked at American time use data from prior to the crisis, where people were asked, can you work from home? Is there an ability to work from home? And we found a big gender difference. 28% of men said that they work in an occupation that in principle lends itself to telecommuting, but only 22% of women. And then the other factor we thought was very important is whether your job is considered critical. If you work in critical infrastructure, most likely you're not going to lose your job. Now, most people thinking about frontline jobs or critical think about nurses. And so you think about a lot of females working there. However, if you really think about it, you want to add energy, transport, and a certain other critical infrastructure jobs. And so there we actually found overall more men are working in critical infrastructure. So to give you the numbers, we found that 24% of men work in occupations that are considered critical infrastructure, but only 17% of women.
Matthias, I noticed from the definitions of what are telecommutable and what are critical jobs, these are quite rough measures. Are you confident of the story that the data is telling here?
Yes, we did this initially 6 weeks ago before the numbers came out, and then it was a rough classification. However, the work that has come out since then has really, I think, confirmed that initial impression. So there's a number of papers since then. Francine Blau, for example, and co-authors have worked on this also, where they go into much more detail and essentially document the same fact that women are a bit more exposed in the sense of having slightly less protected jobs. And of course, by now we have the actual impact coming out. We're seeing the unemployment rising faster, the employment rate declining much faster for women. So this is really confirmed by what the data is showing. On the telecommuting, the data is actually quite good, because we have this time use survey where people are asked both whether they can telecommute in principle and also how much time do they actually telecommute, say per month. So we have really detailed data on people's ability and actual exposure to telecommuting, which does seem to carry over what happens inside the crisis.
Now let's turn to the impact of childcare on this, because I noticed this is also something that's getting some coverage as well, and you covered this in your paper too. Michèle, you're not going to have to explain the childcare impact to a lot of our audience, because many of them will have asked their partner, can you take care of the kids today because I've got to watch a webinar. But how big is the difference in the childcare burden for women compared to men from your data?
Yeah, so let me start by saying, how important is this for the macro impact? So 1/3 of all working workers in the United States are actually parents with children 14 or younger. So it's 1/3 of the workforce is affected. So obvious question, who will watch these kids while schools and daycare centers are closed? So one important thing to consider is the number of single parents. So it's actually 15 million single moms in the United States right now, and those most likely will shoulder the entire childcare burden themselves. There is no one else, especially since grandparent childcare is highly discouraged. Second, what about married couples? Well, among married couples, it's much more likely that a husband works full-time than the mother. So there's more families. In fact, let me give you the numbers. 85% of married fathers work full-time, but only 61% of females. So in those cases, more likely the women are shouldering the majority of the childcare. So let me give you a number that might be more surprising to many of our listeners. So among those couples where both of them work full-time, and this concerns about 44%, of couples, women still do a lot more of childcare. So even though both work full-time, 50% more of childcare is provided by mothers. There is also, though, the opposite. There are couples with an opposite division. So think about a nurse. A nurse has to work in the hospital. She cannot watch the children while she does that. And consider a husband that might be an office worker who can telecommute right now. So those situations, most likely the father is currently watching the kids. And we estimated, based on the occupations, that about 9 to 12% of couples are in the situation right now where the father is the primary childcare provider.
Matthias, this really does expose the how informal childcare has been used as a way to enable people to get to work. And that's kind of been taken away, hasn't it? Especially because Michèle mentioned the role of grandparents, who now can't do that task anymore. And that's especially something that for a single female parents is a huge impact.
For sure, yes, it's a huge impact, and we do see that in the data. So we do see that female employment is dropping faster, not just because of layoffs, but also because of just being unable to work because of childcare responsibilities. And we do see also in the data that comes out right now that the division of childcare in the crisis does reflect the usual pattern. So maybe I just show you one picture on that. So here's a study, a survey in a few countries that asked people in this crisis who is doing the childcare. We have the men in blue and the women in red, and you see that even though everybody is doing a lot more than normal, the men are certainly doing a lot more than they usually do, it is still the case in all of these countries that the women are doing the majority of this work. And given the just sheer magnitude of this change in childcare, that has a big impact on employment opportunities.
It's very consistent across the countries, isn't it?
Yes, schools are closed everywhere. Children take the same amount of time, so it is really a very similar across countries. In terms of the childcare, not so much in terms of employment, because there the legal situation also matters. How much employment protection do you have in different countries? I do want to underline what Michèle said, that even though we see this large rise, we do see these couples too, where we have a reversal of roles during the crisis because of the pattern of employment. And that's also something that's already very visible in the data. So here, for example, is data from Germany, where couples are asked who is doing the majority of childcare in the crisis. And here we see that currently about 20% of couples in Germany, it is the fathers, it is the men that do the majority of childcare, which is very unusual. It's a very low number in usual times. It has gone up a lot. So on average, it hits women a lot more, but we do see at least a fraction of the population where a role reversal is also taking place inside this crisis.
So Michèle, this paints a picture that cohabiting couples are perhaps beginning to adjust their working hours to cope with this, but still a long way to go.
Yeah, we do, as Matthias just mentioned, we do see a lot of changes in working hours, particularly so for single parents. Among the married couples, women are adjusting their hours downward on average by more than fathers. What's interesting also, let me mention another study by Libertad Gonzalez and co-authors. They looked in Spain, what happens to the division of home hours essentially, and fathers or men more generally are doing a lot more shopping, but in all of the other categories of home hours, it's mostly women picking up the slack.
This is very interesting. We did have a question that came in early, and I know that we're going to after this we'll be looking at some of the changes that are happening. But just to preview that, Deborah Larson from Artemis Consulting, she was asking, when hiring does resume, do you see priorities shifting one way or the other as it relates to women or members of diversity groups. She's specifically asking about the US because her opinion is that Europe's kind of ahead of the US on this. Seeing as there's actually one of you on each side of the Atlantic, I'd be quite interested in your point of view on that.
Yes, so as long as schools are closed, it doesn't matter so much. I think, what the hiring side is doing, someone needs to stay home with these kids. And so I think this will, we'll see this for a while, this pattern.
Yes, yeah. Matthias?
Yes, I think that's exactly right. The constraints is what matters right now. It is hard to go back to work until the childcare system is back to where it was, and until there's a bit more equality in the childcare system. We do hope that this shock of childcare, of remotely working, will have some long-term impact, but it will probably take some time.
Yes, I know I'm going to ask you about policy measures as we get to the end, so just prepare yourself for that. But actually, we have a question on that already from Ian McMaster, who is asking what the most effective policy measures are to create a more even balance of childcare and schooling responsibilities. Is this something that policy can even touch because it's happening in the home? Matthias?
It's really a multifaceted question because social norms matter. It matters what beliefs people have, what is the right setup. Policy does matter too, because especially early childcare is very important. So if you have a system where early childcare is affordable and in reach for everybody, it is much easier for both parents to work and to have career goals for everybody. And so you see that countries with a higher female labor force participation rates are usually countries where early childcare is easily accessible and broadly provided. So there's also businesses, of course, that also have to be able to have the flexibility and really recognize that people have childcare responsibilities and that this does not preclude career positions. So it's all three, but certainly government policy is one of those that plays an important role.
Yes. Michèle, what do you think?
I was just saying I largely agree. I don't really have much to add there.
Yeah, thank you very much, both of you. That's great. We'll have more questions coming in after, but first of all, I want to stay in the present and talk about Renée's paper. Renée, tell us about your paper, its motivation and what you discovered, because you've been looking at COVID-19 mortality and how working patterns affect that, haven't you?
Yeah, so I'm sure everyone is familiar with the stories that have been in the news that women seem to be dying less from COVID-19 than men. And so, I guess my motivation was, as a woman, I've been feeling the strain of the pandemic, all the childcare issues and whatever. And I was like, well, is it possible that we actually have a break for a change? So like there's something good, we're not going to die. Unfortunately, the news is not so good. So I took a look at the data. So, I mean, the stories that are out there are that, women are dying less. And so there's some arguments that this may be a genetic factor, that women are somehow biologically more resistant to the virus, or there could be behavioral factors that play a role. And the policy questions are sort of straightforward. Should we protect men more? So if care has to be rationed, should men get priority? That's been some people have asked this question. Should women go back to work first if we open up the economy? That's obviously an important question. And now there are even studies where they're injecting men with estrogen because they say, well, there's something about women, right, that makes them more resilient. So I'm going to show you some data because I think the data really speaks to this pretty well. What I have right here is on the y-axis, I have the percent of deaths due to COVID-19 that are attributed to women. And on the x-axis, I have the percent of cases that are attributed to women. And this line right here, sorry for the squiggle, that's supposed to be the 45-degree line. Okay. And so basically what you see is across countries, the women in terms of, the women have, reasonable fraction of cases, but they're in this data, which is from April 1st, they're always below the 45-degree line. So cases don't translate into deaths, right? So as a share of deaths, they always have fewer than half, half of the deaths than men do. Okay, so now this is as of April 1st. Now let me show you what the picture looks like. On the left, I have the data as of April 1st, and on the right, I have the data as of May 13th. Okay, and now again, you can't see the 45-degree line so well. The 45-degree line is here and here. So these are drawn on the same scale. And basically, what I want you to take away from this picture is that in April, it looks like women are sort of far to the right of the 45-degree line. By May, that's no longer the case, right? So here we even have countries where, you know, basically the percent of cases for women also maps into the percent of deaths for women, okay? So there's a clustering of countries much closer to the 45-degree line. Not only that, the other thing I'd like you to take away from this is there seems to be a lot of variation, right? So you look at this graph and you say, well, it's not like every country has exactly the same experience. And as soon as we have variation in the data, then that sort of raises a question whether biology can really be explaining this, right? So are women in different countries genetically so different from men? Pretty hard to argue, right? So let me just make this point using other data. So what I have right here is data from US states. And let me say that this data, you know, it's very difficult to get the data for the US. Not many states report gender disaggregated data on both deaths and cases. So here I have the few states that do report it. So again, it's the same idea that on the y-axis we have the proportion of deaths that are due to women, and on the x-axis we have the proportion of cases that are due to women or attributed to women. And again, the dashed line here, I'm not going to annotate this time. Hopefully you can see it. The dashed line is the 45-degree line. And again, you see that on the left, we have data from April. So there's a big clustering down at the bottom of the graph. So the states are far away from the 45-degree line. But then on the right, you see that the states move closer to the 45-degree line. So again, there seems to be a convergence towards deaths translating, cases translating into deaths, but also the other point is that there's a lot of variation, right? And again, so now we have one country where there's variation across states, even harder to argue that this is due to biology, okay? Okay, so there's variation in deaths across countries and states. So basically I said, well, what could possibly explain it? As soon as you think about social distancing measures, you think, well, you know, the reason we shut down workplaces is so people don't get exposed. But if women are staying at home anyhow because they're housewives, they do more work in the family, they're less likely to be exposed, right? So one possible explanation is that the variation could be explained by work patterns. So now I'm showing you a slide which basically illustrates this idea. So on the y-axis, I have the proportion of deaths that are attributed to women. And on the x-axis, I have the proportion of full-time employees in a country that are female. Okay, so you take the full-time workforce, what fraction of that is comprised of women? This is OECD countries, and basically you see that it lines up pretty well around the fitted line that I've plotted there. So countries where more women work full-time also have more deaths due to COVID-19. Now, what are the potential mechanisms? So I posit there's two potential mechanisms. There could also be more, but one potential mechanism is that the more you work, the sicker you get. So you may have more underlying conditions. And I show some evidence that is consistent with that idea. So the burden of disease for women along in some dimensions seems to be higher when more women work full-time in a country. But also it could be that the more you work, the more exposed you are, and so the more susceptible you are. And let me just show you some evidence that's consistent with that. So here I have a graph, which is the proportion of medical doctors in a country. That's the y-axis. plotted versus the proportion of women of the workforce, the full-time workforce that is female. So you see that countries with more women working full-time also have more women as a share of medical doctors, right? Now let's look at the share of medical doctors and deaths due to COVID-19. So here on the y-axis, I have the, again, the proportion of deaths that are attributed to women plotted against the proportion of medical doctors. And so here you also see there's a positive relationship, right? So, and not surprisingly, I mean, we've all seen these stories about healthcare workers being exposed. So my point is that, you know, this is also related to women's work patterns and occupational patterns, right? So if you work more, you're more likely to be exposed. It may be because more women are more likely to be doctors, but it may also be in other workplaces. Okay, so the point is simply to make the argument that, you know, it doesn't seem like women have a break, right? Like they're not genetically superior to men necessarily. Social factors appear to be important. And this is really important when you think about how care should be allocated and, you know, thinking about, you know, who should go back to work earlier and whether policy should differentiate based on demographics.
Renee, that's very interesting, and there's one point that came up early in that. You were talking about how difficult it is to get gender disaggregated data in this crisis. And I remember I was reading Caroline Criado Perez's book Invisible Women, where she talks at length about healthcare outcomes for women, and she points out that one of the major problems in this is that we just don't have information because there is a lack of gender disaggregated data. This is a huge problem for you, clearly, in putting this together. And it's going to carry on being a problem, isn't it, when we investigate this?
Yes, exactly. I mean, this relates to my point earlier about how I just don't think it's, you know, people talk about it, but they don't talk about it enough, right? So the data should be gender disaggregated. It's amazing how much data is not gender disaggregated. And back to Michèle's point, this should really be, you know, on politicians' agendas. It's currently doesn't seem to be.
Absolutely. And it seems remarkable as well that some states have gender disaggregated data in the US and some do not. It would seem to be something that would, something that you could mandate at a sort of federal level, couldn't you?
Right.
Yes. Now, the other thing that I notice you are cautious about in the paper as well, about clearly stating causality in this, that these differences in working patterns are the causes here, although your data is very suggestive of that. Is this something that more long-term data will help to clear up?
Yeah, potentially. I mean, I've been thinking about it. So here, you know, reverse causality is obviously not really a concern in the setting, right? So the thing one might really be concerned about is there something else at the country level that could possibly explain these results? And it's possible that there is, and I think, you know, I think this is a really interesting question that deserves much more research. I guess one point I would like to make, though, is that, you know, it seems pretty clear that it can't be biology, right?
Yes.
So, you know, I wouldn't want to claim that, you know, if you work more, you get more diseases or you're more likely to die, right? But, you know, it's not like genetic differences could really explain these patterns very well, right? And so, you know, I guess longer term research would be important to disentangle, you know, competing stories here, but I don't think it's just biology.
No, but it is remarkable how much attention that the biology question received, and it was, you know, that really did get a lot of coverage, didn't it? Whereas once you dig into the data, then perhaps that becomes harder to report than a simple women are having a better time of it.
You're right.
Yeah. Now, there is also, talking of jumping to wrong conclusions, then clearly there'll be some people who leap on this and say this is a justification to discourage women from working in what might be hazardous occupations during COVID-19. What do you say to that?
Well, I guess I would say that probably everyone should be discouraged from working in hazardous occupations, right? So So I guess my point is women and men are probably more similar than not. And if they do the same things, the same policy should apply to them, right? So, so I think this paper is really, I think, highlights that pretty well, right? So men and women are probably not biologically so different in terms of susceptibility, and we should treat them the same.
I do have actually a methodology question from Mark Heath here, who's saying, don't your first slides already control for gender differences in exposure because they look at the gender share of cases versus deaths?
Potentially, right? So, you know, if you look at the data is obviously, well, we've also all seen the stories about how bad the data on this is, right?
Mm-hmm. Yes.
So, so that's actually why I showed you the April 1st and the May 19th data, because what you could clearly see is there's sort of this progression in the data. And my interpretation, and this is where the longer term analysis would come in, is that probably women may be initially less exposed, but then eventually they will be exposed, and then they're also more likely to die. So I think, you know, the fact that you see, you know, the numbers sort of moving closer to the 45-degree line as time progresses sort of suggests that maybe men were hit harder first, and then later on the women get hit. So this is a potential story. So yeah, I think there is an exposure element in there, but you know, the death data seems to be sort of more reliable than the case data. At least that's my understanding from the medical community. So that's why I focus most of the analysis on the deaths. But you see the same pattern. So I showed you percent deaths plotted versus women's participation in the workforce. You could do the same thing for cases, and you get a very similar pattern.
Mm-hmm. There is, I'm not going to bombard you with hundreds of methodology questions, but there is another interesting one here from Sonia, who's saying that could it be that countries that have a higher percentage of women working full time have a higher life expectancy and an older workforce, so that women die more there because they're older there?
It could be, but you know, then the men, I mean, I guess that would be sort of related to the, yeah. So one of my points is I said, well, maybe if you work more, it could be that you are older if you're in the workforce, but also it could be that women who work have all the same comorbidities that the men have, right? So so there's evidence that work is associated with a greater risk of heart attacks, for example, right? And so, so is it men are more susceptible to heart attacks, or is it, well, as soon as women start working as much as men, they're also susceptible to heart attacks, right? So this is related to the age question. And so I think that could be going on, and that could be part of the explanation, that you become more susceptible when you start having similar work patterns. So I do run some regressions in the paper, and I control for some measures of, you know, the percent of, you know, women's exposure to different potential diseases. This, I think, is a really interesting question that actually, and this gets back to the data issue, I don't think people have really explored very much in the economics literature. So I think there is a lot of sort of long-term work to be done here.
Absolutely. And I think, you know, having read the paper, I would recommend it to people because it really is the amount of work that you have to put in to modeling data, which is so imperfect, but it's the best data that we have to get some cautious answers to an important question. It really does go through all the steps in that, so I really would recommend it. Just have one question before we move on, and it's a question that we got in beforehand. It's from Jaya Young Mahat from the Nepal Institute for Policy Research, Renee, and she is asking how risks for women in low and middle income countries differ from those in advanced economies, what this means for the majority of women employed in the informal sectors there. I guess she's saying sort of healthcare risks there.
Yeah. So yeah, basically, so what I've focused on is whether you work or not, right? But
Yep.
There's a lot of other dimensions which is related to healthcare, right? So like, you know, actually in my analysis, I look at the World Economic Forum's Gender Equality Index. One component of that index is sort of a health, it's a your access to good healthcare and sort of the status of women's health in the economy. And there's a lot of variation in that, right? So, obviously, if you start from a situation where the health conditions for women are not very good, then staying at home, like being less exposed because you don't work is not going to cut it, right? So, yeah, there's a variety of factors that play a role. But I guess in the end, again, I think this gets back into, there's a lot of interesting work to be done here. But what I really, or why I think this question is interesting is also highlights that social factors matter, right? So this, again, the question is getting at a social issue, right? So the risk may be different for women in different countries because of social conditions. It's not just biology.
Yeah, thank you very much on that, Renée. And it really is such a good example of how the easy biological story that everyone jumps on really does need some unpicking. And I hope there is a lot more work on this as well. I want to move on for the last third of our time today, back to Matthias and Michèle, because there is another part to your paper, isn't there, that you were talking about how working patterns are changing, and we're throwing around this phrase, the new normal, at the moment, about how our work is changing. But you identified two channels that might, and I emphasize might, promote gender equality at the workplace in the future. I'll give you one each. First of all, is flexible working. And the fact that more of us might be working flexibly in the future. How does that affect it? Who wants to take this one? Matthias or Michèle? Who's going to volunteer?
So yes, we are looking at the long-term consequences of this shock. Medium-term is not that great for women because we know from other recessions that losing a job in a recession has very persistent impact on earnings. So many of the women now affected will have lower earnings for perhaps a long time, may not be able to get back to the same step on the career ladder, and that is certainly not great for gender equality. But we see the silver lining also more for the long term. This has to do with the fact that if you ask, why is there a gender gap in the first place today, it has a lot to do with children and childcare. We observe in the data, there's many papers on this recently, that the gender wage gap is very low before people start to have children. So among people in their 20s without kids, very little of a gap. However, once you start to have children, the gap opens up. Fathers, their earnings keep on rising. Mothers often fall behind, don't get the next promotion, maybe reduce their hours. So this is where this comes from. And this has different aspects. To some extent, it's maybe a social norm and expectation of what should be done, but it also has to do with what happens inside the business, inside your place of work. So if you have a place of work where there's an expectation that if you are in a career position, you have to be always available, never leave at 4 p.m. for the, to pick up your sick child, never take a day off to take care of family responsibilities, well, it's going to be very hard for two parents to have that kind of commitment and also have a family. So businesses not offering flexibility is one of these key points that generates this gender wage gap. What we're saying is that in this crisis, we see a huge and immediate switch to much more flexible working. All these businesses are adapting to people working from home. We are now working on Zoom. We have much more flexibility in bringing this responsibilities in the home and at work together. And this massive change is there to stay. We already hear now that Twitter says they will now permanently allow working from home for everybody. Businesses realize this stuff works. It saves money on office space. So we can be, I think, quite certain that some of this added flexibility is going to be there. And this is to some extent just organization. It's going to be easier to combine those responsibilities. I think it's also a bit of a cultural shift inside companies. So now you have board meetings, and now it's probably a common occurrence, just like as in faculty meetings, that during the board meeting, the 4-year-old daughter of the CEO walks in and asks for a glass of milk, because even executives have children, and now this becomes all public knowledge comes out in the open. And so the hope is that this will also give you a bit of a shift in expectations in expectations of what people in career positions should do, that it becomes more acceptable to combine your family responsibilities with your work responsibilities.
Matthias, can I ask you something about that? In your statistics, it's still a fairly low proportion of jobs that are teleworkable. And yes, they can adjust much more easily than the others, can't they? So is there going to be a gender inequality opening up from that point of view, where people in the jobs where there are faculty or boardrooms, they can adjust, other people cannot?
I think that's a good point. So we do see in the existing data that being able to telecommute has a huge impact on childcare responsibility. So if you look at men, for example, who can telecommute, they do about 50% more childcare than men who can't. So it's a big impact. And so in those jobs where that's possible, that's going to make an impact. But you're totally right. This is not going to be every job. Many jobs are not in that category, and so there will be some inequality in this. I think this inequality is perhaps not so much across gender, but perhaps more across income. So there's recent studies showing who can telecommute, and you see that people with higher education and higher earnings in general are more likely to have these jobs because they're more likely to be office jobs or, say, faculty positions. And so yes, I do think this change will come, but I think you're right, it will affect people with better starting conditions already more so than those who have lower earnings today on average.
Yes. Michèle, you also investigated the change in
that, because the gender wage gap is also the largest exactly in those professions we're talking about. So if you're talking about, lawyers, for example, a lot of high skilled occupation, that's where we see a particularly large gender wage gap. So that's why I think this mechanism Matthias was describing is particularly important there.
I see. Yes. Yes. And sorry for talking over you, but there is one thing I also wanted to ask you: the change in social norms that you predict might occur because of this. How's the mechanism by which that might occur, and how fast can it occur?
Yeah, so I think there's at least 3 different mechanisms that might be important here. One, Matthias was already talking about, so that sort of changes on the employer side, the social norms on the employer side, that they find it suddenly, more normal that even fathers do have children and may have to leave. So that's clearly one mechanism by which social norms can change. Another mechanism is the learning by doing of the fathers themselves. So maybe they thought previously they were not super involved with the children and, found it just hard or were not so experienced in schooling, helping the kids with the homework or watching a toddler. And now they learn they can do it and maybe they really enjoy it. And some of this I think will stick after the crisis is over. And then third, I think there's also, let's call it the role model effect. There will be other fathers who, these dads on the playground, they're very visible now, even in the middle of the working day during the week, and something we haven't seen so much in the past. So seeing more fathers more directly involved, I think will have an effect even on those, fathers and families that are not directly, impacted by this during the crisis, but more long-term sort of by watching other couples.
Now, I've got a question from Laura Nozaher here, which has been voted up by a few people, actually. And so I'm going to ask this one. I might ask this one to all 3 of you, actually. And it's asking, what is it going to take for women to demand to be in equal relationships, or for men to dare to prioritize their children? Where do we start? A little bit of frustration there. Who would... Yeah,
one thing,
Michèle.
I don't think is the only answer, but one thing I think we need to even start with the marriage pattern. So a typical situation is men marrying younger women or women marrying older men, and they're just more advanced in their career progression. Or even if they're the same age, typical example, a doctor marries a nurse, not the other way around. And so then when it comes to childcare needs, just financially, it makes, if you decide one of them or discuss who should work half time, even outside this crisis, financially, it just makes a lot of sense that the woman, scales back if she earns less. So I think some of these marriage patterns play a huge role here. I'm not saying it's the only role or the only reason, but I think that's where we got to start.
Matthias.
So for sure, social change takes time. Even in the most, we often talk of Scandinavia as Sweden as the paradise for gender equality. Even the Swedish data, we see that the women do a lot more of the childcare than the men. So these things don't go away overnight, and they will not do this in this case either. But I do think there's a couple of factors that do point towards long-run change. One is that, in fact, we now have an education gap going the other way. You know, so women getting a lot more high school degrees, more advanced degrees, and this does show up now clearly in the data. You know, so we have a gender wage gap on average. In recent data, we looked at the gender wage gap across the whole distribution of couples by income. What you actually see is that among lower income couples, the women, the wives now usually out-earn their husbands. This is because there's many more women with college degrees now than men. And so this, you know, it takes time to feed through the system, but this observation of a wife being the primary earner and the husband being a secondary earner is becoming more common already, and it will only speed up through this process. And the second thought, I think that is maybe, you know, not going to get us there all the way, but I think will accelerate this process, is just the observation that to take social norms, it sometimes does take a shock. You know, and what we are observing right now is a huge shock. It's a huge change in the awareness and the perception of the childcare needs and of these challenges of bringing childcare and careers together. I want to show you this one email, which I find very telling. This is an email I got from a random person. We put out this paper, and this woman wrote to us that she was very excited to see our paper. Has never happened to me that somebody from the general public wrote to me about a paper saying that made them happy. But what she is saying is that in her family, things now have turned around. So her husband is a dentist who can't work right now because that's a high-risk occupation. She keeps on working from home while he takes care of the children. And so she says this has completely changed her family life, had a profound impact and life-changing impact on her family that would have never happened without this pandemic. You know, and this is just an example of one of those shocks that happen very rarely, but I think that often are the cause of social change. So we talk a bit about, if you think of this earlier change of having a high participation in the labor market of married women in the first place, the shock of World War II had a lot to do with that. You know, that you had this 2 years where millions of women went to the factories to work, and it became a completely normal, accepted thing, which it wasn't before. And I think it's important to keep in mind what's happening right now is large. It is life-changing for many people, and it does put more men in charge than before. It will not get us there all the way. You know, these things take many years. In fact, literature shows that often it comes through the children. You know, that children now observe this change, and then in their own life, 20 years later, they will make changes. So by no means it's going to be a quick process. But I do think we're going to see at least an acceleration because of what we're going through right now.
Well, I was just thinking, you know, like, what does it take for women to sort of step up? And I think one thing that's super important is you can't believe everything that people tell you about how women are and how men are, right? I've seen, you know, sort of following the discussion in the media about, for example, female leaders, you know, the women who are running countries, and, you know, people are so surprised that there's some women who are able to navigate the pandemic well. And they have all sort of, you know, there's a lot of sort of stereotyping going on. And so I think, you know, what's super important is people have to step back and say, you know, is that really true? Ask more questions, become educated, right? So I think education is super important. Asking questions, being critical is super important. And it's both for women and for men, right? So you can't just accept, you know, things are the way they are because there are differences between men and women. You have to say, well, why are things the way they are, and where does it come from? And once you understand that some things are just convention, you can change them.
Yeah, it is. And actually, we're getting members of the public sending emails to the authors of the papers to say that it does affect them. It's better, you know, it's good that this stuff begins to cut through. I've got a comment from Michèle Pagel here. We find that in transaction level bank account data from a fintech app that women are more affected than men. I believe that's going to be about the loss of income, that women are more affected than men in this. I guess, Michèle, could I put this to you? This is the sort of data that is now beginning to be available to economists, rapid data, this sort of micro level data, talking about the experiences of individuals. This is the sort of thing that's going to help us monitor how much progress we're making on this.
Yeah, absolutely. So as Matthias said, we wrote our story or our paper 6 or 8 weeks ago. So this was as the pandemic was starting. And in the meantime, a lot of people have been collecting amazing data, starting new surveys, or using microdata from bank accounts, exactly as Michèle Pegel is doing. So far, a lot of our predictions have been confirmed in real-time data. And it will, more and more is coming up, and that will really allow us to measure the extent of all of this. Absolutely. So it's great people are doing that.
Yes, and Matthias, I'm going to give Minu's asked, do you think he's skeptical, do you think these changes in gender roles may be permanent? Is there perhaps, even though there is a big shock, is perhaps the idea that this is a big shock will then mean that the new normal was going to look very much like the old normal? Do we know very much about that?
We can track how gender norms change over time from surveys. So there are surveys, for example, that ask, is it bad for kids if the mom is working full time? And 40, 50 years ago, most people thought that was the case. Now it's much fewer. You see these things change gradually, so they don't just jump from 0 to 1 from 1 year to the next. So so it will take time, but the kind of changes we are experiencing now are the kind of changes that accelerate this change. So we do think it's going to be persistent, but still a gradual process.
Yes. Now, we've got a few minutes left now, but I just wanted to ask you a question. When we do this on Vox Talks on our podcast, that we often ask the guests to be policymaker for the day. You can affect a policy. You get the chance. It's going to work if you put the policy in place. It will be put in place. Is there a policy that you think will be able to sort of move the needle in the dimensions that matter here that we've been talking about today? What would that be if there was something that you could do? Who wants to go first? Is Renée, can I put you first on this one?
Yeah, I guess in the context of my paper,
Mm-hmm.
I guess the policy or the immediate policy intervention is just we need better data, right?
Yeah.
We need better data, and let me put a plug out. We need more subsidization of research into women's health.
Yeah. Okay. Yes. Good plug.
So I think that the acute immediate crisis really needs attention by policymakers right now. So we can talk about the long-term stuff later on, but essentially I think governments need to subsidize income, replace of employees who cannot work right now because of childcare needs. Similarly, unemployment, usually is only given to people who got fired. But suppose you quit voluntarily because of childcare needs, I think you should be eligible equally. Similarly, government programs like TANF, they in usual times have, the requirement that mothers work, and that should be waived. It makes no sense in a time where essentially single moms cannot work to require them to work or search for a job to get such assistance. So such needs should be waived. Similarly, if we're talking about more high-skilled occupations, think about universities. I think we should extend tenure clocks, for example, for parents with childcare needs, and also encourage other private sector employers with up and out promotion systems to think about this. But maybe the most important thing, thinking, as soon as we think it's safe, we really need to reopen the schools. I think this should be, or figure out how to open them safely. I think this should be a first order, priority.
Yes, yes. Matthias, for you, Michèle, you're going to need more than one day to actually do all those policies. Matthias, for you.
So I think Michèle said everything I was going to say. I just want to underline what you said about universities, not just universities. What I really do find surprising is that many of the responses you see from employers are not really taking this issue of childcare into account. So universities all across the EU and the US have now extended tenure clocks for everybody. But it's just obviously apparent that the impact is hugely different depending on whether you are taking care of 2 toddlers at home and you're completely unable to get any work done, or you don't have kids and you can just now work full time and put out these papers. We see it, in the data already, that many of these COVID papers are written by more male authors and more authors without childcare responsibilities. So the issue of childcare responsibility is really very central to people's impact in terms of their work and careers, and that's something that just needs to be taken into account. I'm actually surprised it's not happened much so far.
Thank you very much. I need to wrap up. Before I actually wrap up, I just want to, there's a comment here from Alessandro Tarozzi, who's saying he's going to have one of his colleagues, Libertad Gonzalez, who has published a paper. A side effect of men spending more time with their children is that possibly they want to have fewer children because they finally realize how much effort it takes to raise them. So that's good. There is another paper as well that I wanted to mention that's coming out imminently. Sarah Smith from the University of Bristol and Almudena Sevilla, UCL, looking at the gender division of childcare. That's from survey data as well. And as you've both mentioned, there are many, many more papers coming out about this. But I do have to mention before we wrap up the two papers that we've been talking about today, because they are both open, free for you to read. And there is a wealth of detail in that will answer some of the questions actually that we haven't been able to get time to talk about today, and I really do recommend them. So the first one is the impact of COVID-19 on gender equality, and the authors are Titan Allon, Matthias Doepke, Jane Olmsted-Rumsey and Michèle Tertilt, and that is in COVID Economics issue 4. And also we have Gender Equality in Work and COVID-19 Deaths, and that's by Renée Adams. That is in COVID Economics issue 8, I think. I didn't write that down. It's in one of the COVID Economicses, and they're both free downloads. So please do read them. Thank you very much to everyone that came along today. Thank you very much to everyone on the panel. That was great, and thank you for answering all the questions that came in and for your presentations. We hope to see you soon, audience, both the people who are here today and everyone that's been watching on Facebook Live. From all of us at the CEPR, please stay positive by staying negative.